My name is Anne, Dr. Anne Moraine. I am from France, and I came, I think it's 37 years ago, to help Dr. Goher. First I was at Merazad for almost 1 year. So I'm learning Marathi on the job. I'm functioning in English, and my training is in French. So it was quite a gymnastic. Yeah, it was not easy. You don't come here I didn't come here to practice. I came here to be around the Mandali, basically, because I felt I do not really understand about spirituality and what Meher Baba says. But if I'm around people who have lived with him, you imbibe things just by being around them. I was trained as a general practitioner, and then when I was a resident, I studied acupuncture. And then when I came here, I discovered homeopathy because they were, from Padri's legacy. And I could see the good results in the dispensary, to the point that I took a correspondence course and I studied homeopathy myself. So I'm a jack of all trades. Once somebody, I think he was British, at Merazad, somebody said, so suppose something happens to me here, how do you get an ambulance? And I realized I didn't know how to get an ambulance to Merazad. So I talked about it with Erich and Mani, and they looked at me, we're talking almost 40 years ago. They looked at me as if I was crazy, as if I was asking for a helicopter. And they say, if you need to send somebody to hospital, well, you take whatever vehicle is here, you put a mattress at the back of a jeep, and that's how you send the person. And we've done that quite a few times. And I think 20 years before we had our own ambulance for the trust. And when I came here, this place was being built, this hospital. This remained a hospital that works only during big gatherings, Amartiti, Silence Day. The rest of the year, it is used as an outpatient place for the staff, all the workers of Mehrabad, the pilgrims who are in the hostels. There's a consultation. And the main activity has been the cataract surgeries. Cataract surgery was started by Meher Baba in the early 20s, in the early years of Baba settling in Mehrabad, in what is called now the old Dharmshala. So the doctor had told him that many people were blind because of cataracts and they could be operated. So Baba had made the arrangements for an eye surgeon from Nagar to come and operate cataract patients here. We have an operation theatre that is dedicated to eye surgery. We have very good modern equipment with operating microscope, and we put intraocular lenses. This has been going on for 10 years now. And we have a minor OT for minor surgeries or stitching wounds, opening abscesses. So the dispensary in the village is very active. This is open to everybody. Normally they have about 120 patients every day. 3 doctors, a homeopathic consultation, a dentist 3 times a week, eye doctor once a week, pediatrician, gynecologist once a week, a lab. And then we have a homeopathic dispensary over there. Presently, with the COVID, the patient load is much less because people don't travel. So they see about 50 to 60 patients with all the precautions of protecting the staff. But it's, it is the most important medical place, running 6 days a week. It was not always easy. And it was a good, ego rubbing. When I came here, somebody told me, you don't come here to work, you come to be worked upon. And the work is to grind the ego down.